Hello and welcome to an NG tube insertion tutorial. We will be going over the anatomy involved in this nursing skill, the procedure step by step, and the bedside manner that will help your patient go through this smoothly. First of all, the purpose of an NG tube is to help remove gastric contents from the stomach in the event of a GI bleed or bowel obstruction, or to assist with temporary feeding of a patient. The first step is to check your patient's ID band for confirmation you have the patient for this procedure. Next, assess his or her nasal airway.
We're good.
If both nostrils appear patent, ask your patient which nostril he prefers.
Which one do you prefer? Jim Jones.
Giving your patient options and small amounts of control can help relieve his or her anxiety. Let's begin to prepare the procedure. The equipment you will need are the following: gloves, NG tube, lubrication,
It's right here.
emesis basin, tape, and a cup of ice chips, along with one syringe. Apply your gloves and measure the NG tube from the tip of the nose to the back of the ear and down to the xiphoid process. Make sure your patient is in high Fowler's position. Add approximately 1 inch to your marking. Place a piece of tape to mark the NG tube after measuring. Give your patient ice chips in hand and lubricate the NG tube generously. Ask your patient to look forward and bend the NG tube slightly to approximate a 45-degree angle, about 5 inches from the tip. Begin to insert the NG tube at a slightly upward angle and advance the tube as you approach the 4 to 5 inch mark. Ask your patient to look down at their legs. Ask them to swallow, and as they swallow from the melting ice, advance the tubing quickly. Repeat the process, asking them to swallow and advance the tubing until you've reached your marker you measured out earlier. Tear a piece of tape in half to attach the tube to the nose. You're doing great, sir. You're doing great. We can check placement by plunging air into the tube's port and listening for bubbles. But remember, X-ray is the only definitive confirmation of placement. All NG tubes must be X-rayed.
I hear bubbles.
For the best outcomes, remember to talk with your patient about why he or she is receiving the NG tube, and be sure to answer any questions they have and remain calm. Patients are calm when we are calm. Good luck!